So head to toe exam, you're gonna start right here. You're gonna check his head, feeling for any deformations or any softness, tenderness, etc. You're then gonna come check his ears for any fluid that may be draining. Check his eyes, make sure that they're pearl, that his pupils are reacting appropriately. Check his nose for any bleeding or other fluids draining. Check his mouth, make sure that the teeth are still in the way, there's no blood. Just check the bones in the face to make sure that there's no tenderness or loose bones. I'm gonna come back here and check his neck, check his veins in his neck to make sure there's no jugular venous distension. Check his trachea. I'm gonna come in and check his shoulders, check his sternum, have him breathe, make sure that there's no pain there. I'm gonna then come and check his abdomen, all 4 quadrants, upper left and right, lower right and left, check for there. You can check the pelvis. It's not necessarily recommended, but you can. Just make sure that it's strong through there. Check the groin if there's any serious bleeding. And then you're just gonna come and check the legs. Make sure that you're adding counter pressure to make sure that if there's any fractures that you can feel that and they may have any tenderness. You're also gonna come down and check PMS on both sides. So you're gonna check their pulse. Can you wiggle your toe for me? Can you wiggle your toe for me? Okay, check the pulse. Come back on the arms. Also counter pressure. Can you squeeze my fingers? Squeeze my fingers. And then check pulse on both radials. Make sure that they're both good. As far as checking the spine, you're gonna make sure that you take spinal precautions. You're going to make sure that you keep the neck in line. You can roll the patient, log roll them, and then you're just gonna check the back for any step-offs, making sure that the spine is good to go.